It's bringing us in.
Okay.
Yes, ma'am. All right. We here. We live.
Okay.
So, this is Dr. Annette Jenkins, and she's on with us on tonight. I'm going to talk to this audience on Electric James Inspirational Talks. So happy to welcome you here on tonight. I've been really advocating and telling people about you. So here's how it works. You have 30 minutes to share whatever you want to share on your topic of medication or anything, any other things that you would like to share with this audience. But we have been doing our best to promote you on tonight, okay?
Thank you. Well, I'd like to say good evening to everyone out there. And I'd like to thank Electra for this opportunity to be on the podcast tonight. And I just wanted to just share for 30 minutes with you medication safety for the elderly. And that's going to be my topic. But first, let me tell you a little about myself. I am a retired pharmacist of 50 years. This marked my 50th year, this 2021. I am a graduate of the University of Texas College of Pharmacy. I am the second African American female to have graduated from UT School of Pharmacy. And I've had 50 great years of being a pharmacist and being an advocate for health. I've shared many talks with different people about medication. I had Susie Says Only Sick People Need Drugs. We did a program back in the 80s on drug awareness and abuse for kindergarten through 5th grade.
Mm-hmm.
And we touched about 4,500 students. And we really enjoyed doing that. And
1 minute, Dr. Jenkins, I lost you. Hold on one moment. I lost you some kind of way. Hold on 1 minute. It bought Jackie, it bought you back in and knocked her out.
It's okay, no stress allowed.
Okay.
Okay. I'm back.
Okay.
Good.
Okay.
We need to go back and check our connections, Electra.
Mm-hmm.
Go ahead and shrink us. We didn't go live for some reason, so we're going to check our connections.
I'm on
So
live.
back over to you.
We're on live. We're
You
on.
are online. Oh,
Okay.
all right. I'm not seeing it yet, but go ahead. I'm sorry.
Yeah, we're live. I'm looking at us.
All right. Sorry about that. We'll fix this later. No technical difficulties. But anyway, this has been my life dream to help people and educate them on medication. I was the first African American pharmacist hired at Mainland Medical Center. And I also was the first African American assistant director, first African American pharmacy director of both Danforth and Mainland Medical Center, and I retired as the director of pharmacy in 2014.
Mm-hmm.
So pharmacy has been my world since then, and I have mentored many young pharmacists and come out of different pharmacy schools. I mentored pharmacists from the University of Texas, my alma mater, and also Texas Southern and University of Houston. And also, it's just been wonderful to interact with people, to work with the physicians that I had an opportunity to work with, and to train and be a mentor to the young pharmacists that came behind me. I received my doctorate of pharmacy from the University of Florida, and it enabled me to do more and learn more about my field.
Mm-hmm.
So, are we still live? I don't see my picture back up here.
We're live.
Okay, well, I don't
Hold
see
on.
myself on the screen.
Hold on one moment. I can get to something is going on. Hold on one moment, because I'm seeing you over here live. Yeah, we're live. We are live.
I just don't see me in the corner. So I'll just keep speaking if you want me to, but my image is
Yeah, but I see you on my screen, on both screens, and
Okay.
I'm gonna ask them
Okay,
to.
now I see you.
You see me?
I see you now.
Okay.
Mm-hmm.
Okay. Yeah, because
So anyway, that's enough about me. And I just wanted to let everyone know that pharmacy is a very rewarding field. I've had my niece to become a pharmacist, Dr. Ashley Randall Scott, who lives in Georgia.
Mm-hmm.
And I'm just so proud of the clinical pharmacist she has become.
Mm-hmm.
And I'm just going to start into my topic and let me know when my 30 minutes is up because I'm a little long-winded sometimes.
That's okay.
But the reason I want to speak on medication safety in the elderly is mainly because, we have a lot of people living longer and a lot of people that are getting into their 60s, 70s, 80s, and 90s. And we want to be careful that they're taking prescription drugs and over-the-counter drugs and herbal preparation and supplement, and that they are, making sure that they're safe taking these particular drugs. And especially some of the caregivers, because nowadays we have caregivers that are taking care of older parents and older people as they age. So, while I'm especially concerned about the elderly, is that as we age, our bodies change. Certain things that we get older and certain things don't work like they used to. Our heart don't work like it used to. Our kidneys don't work like they used to. Neither does our liver. And the kidneys and liver are the two main organs where the medication that you take, breaks down and leaves the body to these particular organs. So as we're talking about aging and how medication affects your body, everybody's body is different.
Yes.
And as you age, there are certain medication you can take, and you might not be able to take the full dose, or if you have chronic kidney failure, you can't take the normal dose. You might have to take half of the dose. So I want my elderly to be safe. And I want to make sure that as we age, we don't remember like we used to. We have confusions and our memory's not the same. So there are some safeguards I want to talk about tonight to ensure that they are taking their medication safely. They're talking to their physicians and certain things that they need to do. So as we, talk about this, it's not that people, they're living longer. It's not that they're not taking care of themselves, but the thing is that we're just going through the normal age processing. And as you get older, it's like God created the body. And certain things don't work like they used to. So I know a lot of times my memory doesn't work like it used to. I'll go to the refrigerator and say, what did I come in here for? I know you all are doing that these days and time. So the main thing some points I want to make is several points. First of all, you need to take your medication as prescribed by your doctor.
Okay.
And you need to have input from your physician. Because a lot of times, we don't take our medication accordingly to what the doctor tells us to. A lot of times we may be feeling better and we decide, we're going to stop taking this, A lot of times people are guilty when they feel better taking an antibiotic. They said, I'm feeling better, I'll just stop taking it. Well, the doctor said take it for 10 days or take it for 7 days. If not, the infection's going to come back. So we not only have to be attentive to this, but we got to be in compliance with what the doctor's saying. And if you have certain diseases like high blood pressure, if you have certain diseases like diabetes, you're going to have to take that medication on a continuous basis because that's the only way you're going to improve your condition is by having that medication in your system. And so many people, the doctor tell you take one tablet. I often teach my sister because she said, well, I'm going to do with one, so I'll take two. I said, that's not what the doctor told you to do. You don't need to take two, you take one. So make sure that you take your prescription as the doctor tell you to. And nowadays, as we age, we see more than one doctor. So you may see a cardiologist, a rheumatologist, you may see diabetes specialist, your PCP, and so they all need to be on the cord and need to know what's going on with you. So you have to be the one to tell them so nothing falls through the gap. So one of the things that we talk about was very important that you maintain a medication list. You gotta have a medication list of what you're taking because that way the doctor can, all the doctors can be on the same page knowing what you're taking and how this And a lot of times, now that a lot of us are computer savvy, we all have smart cameras. If you don't want to make a list on your telephone. Or if you don't want to make a list on your phone, I tell my patients to take pictures of their prescription bottles. Take a picture, say keep it in your photo album. When you go to the doctor, you can just pull it up and show the doctor all the medications that you're taking. So as we get older, we also get a little computer savvy. So you can do that if you want to, but keep that list really current. And a lot of times when people live alone, their husband or spouses have expired, and so you got to be really careful about making sure that medication list is available. Most people say put it by the telephone. A lot of people say give it to your loved one or someone that you trust for emergency. But I also tell people that put it on your refrigerator door, because a lot of times you live alone. When the EMS comes to your home, the refrigerator is one of the first place they look for emergency numbers, and they look for a list of your drugs.
I didn't know
so
that.
Put it on the refrigerator. Yes, that's one of the things that they do. And also by doing that, also list of your allergies. A lot of times, we're allergic to certain medications. And if you have that list of medications that you're taking, also have a list of allergies. And let the people know what's going on with your allergies. As you keep this list.
Can I ask you one? I have a question. I want to interrupt just 1 minute. I have a question for you. The viewer is saying, Dr. Jenkins, I have NASH and I'm diabetic, so I have to watch out for my kidneys. I am so confused about whether I can take Tylenol or Advil or aspirin or what.
Okay, well, it just depends on what level of kidney damage you have. Tylenol is usually what they recommend. A lot of times the Advil is not as good for your kidneys as people think they are. So if you want to take Tylenol, that'll be the safest drug for you to take.
Okay.
And also on your medication list, you need to write the brand name and also the generic name. Write the dosage down, like if it's 300 milligrams, and if you take it twice a day or once a day. Now, if you have all this written down, then that makes it easier for the doctor to know what you're taking. But be sure to put the frequency that you're taking.
Okay.
So I also want to talk about, when you go to the pharmacy, try to maintain one pharmacy, because if at one time you don't have your list available or you go to the hospital, if we have the name of the pharmacy, we can go back and they can pull up a list of your patient profile.
Okay.
And they'll give you a list of medication from them. But also a lot of times we have mail order prescriptions that we get as we age, because it's less expensive, and we can get the 90-day supply. So what we need to do is make sure that somewhere all those medications have merged together. The ones from the retail pharmacy as well as the one from the mail order pharmacy. And one of the other things about keeping your list is that it makes you let the doctor let them know what you're doing and what's going on with you. And it's also best to have those allergies so they won't give those to you. So as we move on, after we talk about the medication list, I just want to make sure that we talk about the side effects and potential interactions of different drugs.
Okay.
Because a lot of times when you get your medication from the pharmacy, some people just open it up and just take the medication out. They never read the pharmaceutical information that the pharmacy prints out for you. Because this could tell you when to take the medication, whether to take it with food or take it on an empty stomach, and you can have some side effects if you don't follow those instructions. So it's important to read and know about your medication before you start taking it. Just don't pop it out the bag and just start taking it. Read the side effects and the drug interaction. Just like Norvasc, you can't take grapefruit juice with that, or you can't take grapefruit juice with Zocor. So these are things that you need to know. And in order to better educate yourself and understand what's going on. And then with
Mm-hmm.
Alcohol is something else that would interfere with your drugs. It'll make you sleepier if you're taking a sleeping pill, or it'll make you have risk for falls and drowsiness and things of that nature. So make sure you read the instructions and know exactly what a side effect is and what a drug interaction may be.
Mm-hmm.
So as we move along,
Take your time.
I want to make sure that I got another question.
No, I say take your time.
Oh, okay. As we move along, just also take your medication. Know how to store your medication. If it says store in the refrigerator, store in the refrigerator. And on that medication list, also write down all the over-the-counter drugs you may take, the supplements you may take, the herbal drugs you may be taking, because all that gives them a complete picture of what's going on with your body.
Mm-hmm.
Because a lot of times the herbal supplements are not regulated by the FDA.
Oh.
So they call supplements. So a lot of times, because they're not regulated by the FDA, we don't really have enough information on what drug interaction they may cause. But there have been some that they have caused interaction with. And before you go to surgery, they suggest that you stop any herbal medication 7 days prior to the surgery, because they don't want to give you anesthesia and not know what those herbals are doing to your body. So make sure that even though they may be herbal and non-prescription, they can be just as dangerous as prescription drugs if you don't know what's going on with the other medications in your body. Because drug interactions do occur in the body with other medications. And also, when you keep your medication in a safe location, keep it where it's going to be properly stored, not too hot, not in a humid bathroom, but keep it where it's going to be accessible to you, but not to children, because children mimics adults, and if they see you take a pill, they might want to take a pill. So just be safe if you got your grandchildren around and you want to make sure that your pills are not anywhere accessible to them.
Okay.
And pill boxes. Even though people, sometimes say, I'm not sure if I took my medication that day. Well, if you're not sure if you took a particular medication, skip that day and go to, another, do it the next day.
Okay.
Because a lot of times, if you did take it, you'll be double dosing. You don't want to cause more harm. And if it's a drug that you can take the next day that won't cause any kind of distress to you, then you'll take the next day. Because sometimes, we don't read good. Our eyesight's are not as well as it used to be. And sometimes we get confused. But I like to tell my patients to get pill boxes and put their medication in the pill, kind of separate them. And please, whatever you do, don't put more than one pill. Leave your pills in your original container. Like I've seen some people bring in medication with one medication bottle with 3 or 4 different pills in that bottle. And I don't know how they can remember what's in that particular bottle, what's going on with it. So we try to tell you, keep it in the original bottle and make sure that you don't mix them unless you put them in a pill container. Now people have gotten fancy. One drug company is now putting all your unit dose and all your meds that you take at 9 o'clock, putting them all together, putting them in a like a blister pack, and you can take all those at one time. But we have to be conscious of what brand we're taking, and when generic versus brand name, generic companies may change. My husband was upset because he got a blood pressure pill one day, and for years it's been green. All of a sudden it became white. Those people gave me the wrong medication. I'm not taking that. It's not the color. But they had changed brands on it. So yes, for real, I say it's still the same pill, but it's a different brand. So instead of being green, it's white. So anyway, that was a factor that we have to be very aware of. And also, from different medication, we need to make sure that as we dispose our medication, when the medication gets old and it's outdated, don't keep those medications in with your other medications. You need to dispose of them.
That's
and we used to flush them down the toilet. Now we can't do that because it messes with our drinking water. It also kills the wildlife as we take the water and drink it, and they cause problems. So what they tell you to do is sometimes pharmacies have medication roundup. Well, they'll tell you to bring your medication in and they'll dispose it for you. Or you can take your medication that has expired or you no longer take and put it in a Ziploc bag and mix it together and put water in it. Or you can put wet coffee grinds in it or cat litter in liquid to absorb it. And you just mush them all up. And you put them together, put them in a coffee can. And you take it up and put it in the garbage. Because if we flush it down the toilet, we're going to be contaminating the drinking water.
I have just 1 minute. I have some questions for you. I got some more questions for you.
I thought we would do questions at the end.
Well, they're constantly coming, so I'm trying to get them to Mark and make sure that we get them in. And it looks like you're going to be coming back for a second interview because people need your information.
Well, thank you. What can I answer now?
Okay, so we have a viewer that says, what is your opinion of taking B12 vitamin? What is your opinion on taking B12 vitamin?
I take B12 vitamins. It's very good. The body needs it, and it's fine. I have no problem with B12.
So it'd be okay
and it'll be okay. And if your body gets too much vitamins, it just washes it out. B12 helps if you're tired, it gives you more energy, and as we age, we do get low in B12. So B12 is good.
Okay.
I take 1,000 milligrams a day.
Okay, so we have another viewer that is making some comments. Said, I've been guilty of not doing right by my medications. That is until I felt the effect of stopping when I felt like I was better. The doctors prescribe them as they do for a reason. I mix my pills in the same bottle for convenience.
No.
I don't know that I should.
No. Go ahead. I'm
It's on you. You tell them.
No, what did she say?
She said.
Mix them in the same bottle, please. Keep it in the original container.
She said I mixed
because a lot of times you may forget what they are.
Oh, okay.
And the directions need to be on the bottle. I know if you put them in the pill container, that's okay, but don't put them in the same bottle. Don't mix them. Leave them in the original bottle.
Okay.
And you can still take them from the original bottle and place them in the pill container. But you always have the original bottle to go back and compare the markings to see the color of it, see the imprint and the manufacturer. But when you put them all together and you don't have the original bottle, there's no way you can go back and double check. So that's a no-no.
That's a no-no.
And you're supposed to continue to take your medicine as prescribed by the doctor. Don't stop because you're feeling better. Because I had a friend that was supposed to be taking blood pressure medicine. He started taking them, and he said, I don't need this, and stopped taking them. Ended up on a dialysis machine because the blood pressure damaged the kidneys. So no, if you get to the point where the doctor feels you do not need the medication, then talk to the doctor. He's the one that can tell you not to take it, or if we have some other side effect that's coming about. But don't just stop taking it. Just give it for a reason.
Okay. With all of the stuff with the coronavirus and things going on, so how could an individual balance what they're having them to do due to the virus that they may have contracted, along with an illness that they may already have? How would a person balance that?
First of all, the best thing to do is to follow the rules of hand washing, mask wearing, and things like that. And then if you have a condition and you start feeling bad, you need to get tested. you. Asthmatics, because with the breathing and pulmonary complications of the disease, the COVID. So that would be a call for the physician of what you need to do. But you just need to be careful and follow the guidelines that's set up as far as hand washing and staying in and distancing and things of that nature. And get tested so you know what's going on with your body. But yeah, COVID can complicate existing conditions.
Okay. And I believe a lot of people will love hearing that coming from you as a pharmacist, because what is happening within the community overall is people are saying the reason why they are afraid of this virus was scared because they basically don't know what to do, and people aren't really providing information to calm them down. So you coming on here tonight is really a help for many who will see this video. And you're on YouTube, so it's everywhere. People can pull it up from everywhere. And that's the great thing about being live doing this interview, is the fact that it doesn't limit you just to friends on Facebook. It's out there in the world now, and people will hear what you are saying. You have 5 more minutes, and so I want you to share whatever you want to share. And I'm gonna be quiet.
Okay, just to kind of wrap it up, our bodies are our temples. And it's up to us, along with the physicians and the pharmacists and other healthcare providers, to help us keep it well, to keep it going. So my tip to everybody is if you go to the doctor, you pay your money, do what he tells you to do. Sit down and talk to your physician. Just don't keep things to yourself. If something is going on you don't understand and you have a question about it, this is your body, this is your temple. So you need to be able to take time and write your list when you go to the doctor and tell him what's going on with you. Help him answer questions that you are concerned about. You can always call your pharmacist, and ask questions. Because if the physician don't know what's going on with you, that they don't know that this drug is interacting with you in an adverse way, then unless you tell them, they're not going to be able to help you. So we have to be advocates for our own bodies and our own, health, by being able to communicate with your providers and tell people what's going on.
Okay.
And that's what you need to do. I had a friend that had a non-productive cough, always coughing, and been back and forth to the doctor. And so she was just coughing, so they just can't find out why I'm coughing. I said, you're coughing because that's your blood pressure medicine. Those Acaprills, lisinopril, they make you have this cough. And she went back to the doctor, and the doctor said, that is so true. Well, I didn't think about that. But, not to put the doctor down or anything like that, I'm just saying that we're all in this team together. It's just not the doctors, the pharmacists, the nurses, anybody that you have a question. It's no stupid questions. Be open and just tell them, because this is our body, and I want to live as long as I can, and doing the right thing, because that's what's happening. People are living longer because they're taking better care of themselves, and with advances in medications and advances in medicine, we're doing better. So we need to do our part. Like the lady said, she don't always take the medication. Take the medication, because it's to help you. And be safe about your medication, because just like medication is a help to everyone, it can also be, bad if you don't take it right, if you don't do the things you're supposed to do.
Yes.
And that's my platform. That's my speech for the public, to be able to, stay healthy and do what makes us better, and just be safe. And for the caregivers out there that's taking care of older parents and older members, do the
And it's also going to be transferred over to my Facebook page, so people are going to see it once we clean it up, and people will see it, and they'll have feedback. You're going to get some feedback.
Well, thanks for thinking of me and allowing me to come forward because this is what I love to do. I love to talk about medication and safety with the elderly and drug prevention, you know. And I do talks on diabetes, Alzheimer's, and mental illness and things of that nature.
Say that again. Say that again.
I'll be back.
Say that again, what you just said.
I said I also do talks on, drug abuse. I do talks on Alzheimer's. Done talks on diabetes and other things. So I'll be back.
Oh, yes, you will. And we thank you for coming out tonight. This has been a wonderful interview.
Thank you. But thank you. Thank you for thinking of me, Electra. And I just want to say I applaud what you're doing, taking time out to educate and help the community. We need that. The more we do, the more it's expected. But I applaud you for doing what you're doing because there's so many people out there that have questions and don't have avenues or some way to answer these questions. So thank you.
You're welcome and thank you. All right. So, and thank all of our viewers who tuned in tonight. Thank you.